Well, with the new year starting soon, it's a good time to learn and embrace healthy habits. Recently, the first annual Habits and Health Span survey showed surprising results about when and why people start living a healthy lifestyle. A healthier lifestyle can, of course, also help people understand the difference between health span and lifespan.
That's right. And joining us now to reveal the survey results and learn how we can adapt a healthy lifestyle to live a longer disease-free life is Holiday Duren, a product development scientist at Amway. Hi, Holiday. Thanks for joining us this afternoon.
Yeah, hello. Good afternoon.
Good afternoon.
Thanks for having me.
Thank you. It's the time of the year when people start evaluating habits. So tell us more about that.
Yeah, I think an important thing to remember is the difference between health span and lifespan when we think of habits. And there's really an important distinction between the two. Lifespan is how many years a person lives, and many people know this. But health span is the number of healthy years a person lives, free of disability or disease. And we know that the average American's lifespan is getting longer, but they're actually spending more years sick or disabled. And this really mirrors the World Health Organization's statistic around the average American today will actually spend the last 11 years of his or her life in poor health. And so this is really concerning, but there is good news. We know that habits can certainly impact both lifespan and health span and potentially help us close the gap between the two.
Can you explain why it's important, Holiday, to know the difference between health span and lifespan? And what can you tell us about this recent Habits and Health Span survey?
Yeah, so we found many surprising findings in the Habits and Health Span survey that Amway recently commissioned. For instance, 57% of respondents who engaged in healthy habits in the past year said that they did so because of medical reasons. And a large percentage, the majority of individuals, actually started these habits because a doctor asked them to, or they were trying to mitigate a health issue. Far fewer individuals started a healthy habit because they learned it at a young age from a parent or a loved one, and not in response to a pressing health issue. So, these insights really underscore the need to be more proactive rather than reactive when it comes to our health and wellness journey.
Very important. And Holiday, what are some of the other key survey findings?
Yeah, so we found that the majority of Americans, 77%, take at least one supplement a day, and they care about what they put in their body, and they want to know where the ingredients are coming from. And so they're more likely to purchase vitamins and supplements that are traceable, meaning that they can kind of track the path of the ingredient from the time it's grown or produced to the time that they receive it. And that really gives them empowerment and makes them value the quality of the product. They also care about sustainability and a healthy environment, and they want to know that the company that they're getting their products from does as well. We also found some interesting findings with gut health, and that is that, over 60% of Americans actually have suffered from gut problems. And in fact, the individuals, participating in this survey, 1 in 3 of those individuals were actually suffering from gut health problems. So there's a lot to learn there and to help people. And we found also in terms of children's nutrition, many parents living with children are, they admit feeling negative emotions around their children's nutrition. And, they share that they're frustrated or even feel helpless. So collectively, this research is quite compelling and really shows us an opportunity for education, community, and improvement.
Holiday, what's the main objective of the survey?
Yeah, we really set out to help motivate people to live healthier lifestyles and be proactive in evaluating their health and wellness efforts. We really want to, stress that our healthcare system spends trillions of dollars every year, but there's still a large gap between health span and lifespan. But individuals can practice healthy habits to really bring this gap closer.
And what is the final key takeaway you would like our audience to remember about the survey and the topic?
I want everybody to remember that they have the ability to close this gap by making healthier lifestyle decisions and encouraging their friends and family to do so, and really building that community and like-minded people around them. It makes a difference. If you're practicing healthy behaviors and habits, great, keep it up. If you're not, don't feel discouraged. It's not too late. There's always an opportunity to close that gap between lifespan and health span. And to find out more information about the survey and resources around it, go to AmwayGlobal.com.
All right, Amway product development scientist, it's Holiday Durham. Holiday, we appreciate the time. Thank you today. Appreciate it.
Thank you. Thank you so much.